This is Dr. Ramesh Kekunnaya, Head of Pediatric Ophthalmology and Strabismus, LVPEI Prasad Eye Institute, based at Hyderabad, India. If you look at the childhood blindness, we do have every 1 minute, one child goes blind in the world, compared to every 5 seconds, one person goes blind. So that's the magnitude in the world. If you look at in India, by 2020, we will have close to 2 million blind children. And at this point of time, it will be close to 1.6 or 1.8 million blind children. Out of this, if you look at the blind children who are getting this blindness from birth, or what you call congenitally blind people, they do even have a higher mortality rate or a death rate. Close to 30 to 40% die before they reach their age of 5. So in Hyderabad, we did a population based survey. Out of that, we found out that close to 30 to 35% of the disease which affects children are refractive error, what you call eye power or eye glasses, most commonly the myopia. So this is the burden what you are having at this point of time in India. Okay, if you look at the typical eye diseases which affect children, most common I would say is refractive error. It can be myopia, it can be hyperopia. That means short-sightedness or far-sightedness. And more children are born with astigmatism, what you call it as cylindrical power. And myopia as such in the world as well as in India, it's increasing day by day because of more of these electronic gadgets. So at this point of time, top cause for visual impairment in children is refractive error. Next comes the lazy eye, or what you call amblyopia, followed by strabismus, routinely called as crossed eye or squint, as most of the people call it as squint, and its associated diseases like eye movement abnormality, because as most of us have seen, some of the children are born with rapid eye movements. They are all eye movement abnormalities. Following which, there are some of the rare, but these are the diseases. Number 1, childhood cataract, childhood glaucoma, childhood eye cancer, which is rare, but if it is there, sometimes it can be lethal, followed by other causes of irreversible blindness due to retinal problem or optic nerve problem, and very rarely the eye structure itself is not developed, what we call as anophthalmos or microphthalmos or any other congenital birth defects. So to treat this visual impairment or blindness in children, we need to detect these diseases very early in life, because treating these diseases in children can improve their vision. In addition to improving vision, that also improves their brain and overall development of the child. In India, if you look at, we do not have any screening protocol as such done in all the hospitals at birth. So who detects and who is responsible for this early detection? I would say it starts from the parents, especially the mother is the first one to see any kind of abnormality in a child, followed by relatives and family, friends, and a child goes to a pediatrician every month or every 3 months or so for a routine eye checkup, routine child health checkup, or for vaccination. So pediatrician plays a very significant role in this early detection, followed by Anganwadi health workers and other paramedical workers, including sisters or primary level village workers, help in detecting. Overall, I would say early detection is a teamwork. Whoever is involved in the children's care can detect this disease. LUP is unique in its way that our Children Eye Care Center, called as Jastivi Ramanamma Children's Eye Care Center at LU Prasad, is one of its first comprehensive kind of children's eye care center, which was inaugurated almost 20 years ago, with complete package for children's eye care problems. We have a wing for everything. For example, there is a separate specialist for a pediatric cataract, another for pediatric glaucoma, one another for pediatric retina. We do have specialists for strabismus and other eye movement disorders. We have specialists for to take care of children with eye cancer. So as we have multiple specialists to take care of multiple disease in children's eye care, we do have a unique setup where we do take care of children with irreversible vision loss, where none of your surgeries or glasses correction can correct the eye diseases. We provide them supportive treatment in the form of low vision aids or rehabilitation or habilitative work in the form of vision therapy, physiotherapy, where our specialists help them, including their education. And this is a unique setup where all of these things are under one roof. This is also supported in addition by our community eye health reach in the form of school screening or a village level health screening for the children. So the whole package from primary center to secondary to tertiary center makes LUP Children Eye Care Center a unique one. Okay. If you look at our country, we still have a lot of challenges, as in many other health care facilities, including in our children eye care as a whole. First and foremost, I would say that for our population, we do not have enough well-equipped children eye care centers and also children eye care specialists, that is pediatric ophthalmologists for the country. This is from country's point of view. We still need to develop a lot of training for our doctors here in terms of pediatric ophthalmology. In addition, we need to build more and more children eye care centers. Once you have children eye care center, it's not that you have a perfect scenario, even including in Hyderabad. We do have challenges, which is the most important thing is to get the patient to your clinic. As I said earlier, there are different challenges still in 2016 to detect simple disease, which can be, it's not a simple disease, which can be identified with the torchlight, that is congenital cataract in a child, which does not happen even in 2016 for all the children. So first and foremost challenge is to get the children to the hospital, that is early detection. We need to improve significantly. How can we improve? We need to improve our primary care center. We need to train our school teachers as well as paramedics as well as professions like pediatrician to detect this disease. with the simpler methods like red reflex test so that we can detect early. So this is the first and foremost challenge. Second challenge, I would say, as a pediatric ophthalmologist, you need a support staff from anesthetist and other pediatricians. So we need to improve on that. And as in India, as well as in our center, we think that genetics is one thing we need to really develop very strongly in our country, which we are not so much advanced to compare to other countries. So we can do all the surgeries, everything, but genetics is one important factor we need to develop as a whole. So these are the challenges which are there in continuation of Children's Eye Care Center